With so much focus on the global population's physical health, it's easy to forget about our mental well-being as well. But in a new report, the United Nations is warning the pandemic is taking a toll on mental health with a spike in depression and anxiety. Now the UN is calling for immediate action. Neil O'Reilly has more.
The unseen toll of the coronavirus crisis. Stress and anxiety arising from the pandemic are having an impact on the mental health of populations across Europe and the world. Confinement, isolation and restrictions on movement, just some of the pressures of these exceptional times. The UN Secretary-General says governments need to do more to support the vulnerable in particular.
The COVID-19 pandemic is now hitting families and communities with additional mental stress. Those most at risk are frontline health workers, older people, adolescents and young people, those with pre-existing mental health conditions, and those caught up in conflict and crisis. We must help them and stand by them.
The wide-ranging UN briefing on global mental well-being draws on studies from around the world. The figures relating to frontline health workers are especially alarming.
There are some surveys that were done in Canada where 47% of healthcare workers reported need for psychological support. 47%, it's almost half of them. In China, we have different figures for depression, 50%, anxiety, 45%, insomnia, 34%.
With the virus still spreading globally, the UN warns of a likely long-term upsurge in the number and severity of mental health problems. A new crisis requiring a reversal of decades of underinvestment by governments around the world. Neil O'Reilly, Euronews.
Well, for more on this, we can talk now to Neil Greenberg. He's a professor of defence mental health at King's College in London. Well, thanks for joining us here on the programme. Well, we just heard in the report there about some of the risks facing frontline workers, but the UN's warning today is more general, isn't it? So tell us more about some of the risks that people might be facing living with lockdown.
Well, I guess one of the challenges at this time is trying to interpret what the data is really telling us. So you heard there, for instance, one of the speakers talk about nearly 50% of healthcare workers in Canada, seeming to need some sort of mental health care. And I've no doubt that surveys around the world of populations show, again, really high levels of mental health symptoms. However, there's a real question here in what's the normal amount of anxiety to feel when you're going through a pandemic like this. And I think it's very important not to jump straight into the idea that the solution for mental distress is always mental health care professionals. So we know that from lots of studies we've done at King's College London, at our Health Protection Research Unit, that actually teams and communities actually have a really, really big role to play in helping people cope with adversity, but also helping them recover once that adversity has finished. So if you take the example of healthcare or key or essential workers, then actually the people who are distressed at the moment, actually over time are likely to both adapt to that distress and most of them will recover. We will inevitably, though, have a minority of people who will need professional mental health care. But I think it's really important not to overinterpret symptom scores as being indicative of people being really ill. And certainly all the evidence that we've seen from organisations and from communities is actually when disaster strikes, they usually pull together. I think what is important to recognise is probably the biggest issues that are going to arise out of this pandemic come from the social impacts. So the disrupted relationships. We know, for instance, that domestic violence is on the up, and also the economic downturn that will inevitably follow all around the globe. And we know again that actually in periods where people lose their jobs and where they're in periods where people lose their jobs and where they're in poverty, wherever they are, then again that has a really big impact on the mental health of those people. So the solutions, once again, to that aren't going to be more mental health professionals. They're going to be that governments need to put in place strategies to make sure that their populations are really well looked after in terms of their economic protection going forward.
So give us an example of concretely what can be done, because as you rightly say there, perhaps people on the front line will get support from their fellow workers procedures may be in place, but for people who are just perhaps missing their families and the simple pleasure of having a hug or touching somebody, that's going to have an impact over time, isn't it?
Absolutely, I'm not for a moment trying to deny that those sorts of restrictions on our lifestyle are going to have an impact. Of course they are, and many of us are going to be feeling anxious at the moment. And of course, the reality is that none of us really knows how this all ends at present. So it's very hard to say quite what the outcome will be. But for instance, when we've carried out studies looking at in detail at what's the long-term legacy of dealing with infectious diseases in the past, things like SARS and MERS, on healthcare workers, we don't find that 50% of them have long-term illnesses such as post-traumatic stress disorder or depression. We find the figures sort of more in the region of 10 or 12%. So absolutely, some people will need professional care, and it's really important that mental health services are ready to deliver that care. But we have to remember that the solutions for many of the problems doesn't involve a pill or psychotherapy. It involves governments looking to create economic security, and also for communities to kind of come together. As you mentioned, if people can't connect with their loved ones and with their neighbours at the moment, we need to find better ways to bring people together so they can, because that's what protects most of our mental health. And so it's important to recognise that.
Neil Greenberg, Professor of Defence Mental Health at King's College London, thanks for sharing your thoughts with us here on the programme.